Friends and colleagues, I'm Dr. Alfred Lau, specialist in oral and maxillofacial surgery. The topic of the lecture today is the use of autogenous bone graft in implant dentistry. In our daily dental practice, we frequently come across situations where you may wish to place a dental implant, but the volume of the bone is not good enough. It will give you a lot of headache when there is a three-dimensional defect like this. The bone resorption goes both vertically and horizontally, and especially when there is an aesthetic zone where cosmetic demand is very high. Sometimes it could be a large pathological defect, such as this one, after he had a cystic lesion being removed at the anterior mandible. If the bone resorption is at the posterior aspect of the mandible, you have an additional worry about the inferior dental nerve. When there is not enough areolar bone, we could have basically two ways to go if you're going for a dental implant treatment, namely the graftless solution and the bone augmentation. Graftless solutions means that you have ways to avoid putting implant at the non-ideal area where bone volume is not adequate, such as a zygomatic implant, where the anchorage of the implant are mainly at the zygomatic bone. Sometimes we could put tilted implant, shorter implant, mini implants. All these examples of graftless solution. For bone grafting or bone augmentation, there are some basic you have to know. There are three components that it is essential and important for a successful bone augmentation procedure. They are the bone cells, the scaffold, which helps the bone cells to crawl and grow over, and the stimulus to induce the bone to grow into it. Autogenous bone grafting is the only option that gives you all these important components, namely osteogenesis, osteoconduction, and osteoinduction. The general principles of bone grafting procedures are divided into 6 different steps. First, you need to harvest and prepare the graft, followed by preparation of the recipient bed. Fixation of graft is essential to let vascularization take place, and thus proper healing. Tension-free soft tissue closure is the key to protect the graft and provide an excellent place for the graft to heal. We need time for the graft to fuse with the recipient site. Most of the time start with inflammation, bone resorption, and then bone remodeling. After all, we need to re-enter the site for any implant procedures. For instance, in this situation will be a dental implant placement. Bone grafting could be in any form, such as an onlay, inlay, buccal augmentation, vertical augmentation, etc. I will not try this heroic act to stack up bone blocks like this, because the failure rate is high most of the time, mainly due to inadequate soft tissue coverage, wound contracture, and exposure of graft and infection. You have to be very careful and critical with literatures saying these could be successful sometimes. It varies in different clinical situations, of course. Let's look into autogenous bone grafting in details together. It is the only graft which consists of osteogenesis, osteoconductive, and osteoinductive effect, as I've mentioned before. There won't be any graft rejection and minimal chance of infection for this. However, the procedure itself is very technical demanding. You need to be trained, and you have to have a skillful hands to ensure a good success. Many times, autogenous bone grafting face a problem of more bone resorption when compared to biomaterials. Theoretically, the bone graft could end up 100% bone resorption if it is not being loaded after a period of time. There are lots of different choices for bone harvest. These are common intraoral choices. My favorite is a ramus bone harvest followed by a body of the mandible. Chin is also a good size to many surgeons. However, I will put it at the low end as it could cause scarring and stretching over the lower lip region. Sometimes it causes sensitivity over the mandibular anterior teeth too. It's only my personal preference, of course, since there are always pros and cons in different procedures. For extraoral sites, the anterior hip is the most commonly used harvest site. It is relatively easy and low morbidity. It could be as easy as a 30 minutes procedures under deep sedation, and the patient can walk home on the same day after the surgery. This table summarizes the relative volume of bone you could get from different sites and the rate of resorption after healing. This explains why the choice of mandibular ramus and body of the mandible is my choice. Since it has low resorption potential and relatively good volume of bone could be harvested. The maxillary tuberosity is an easy site for bone harvest. However, a small amount of highly porous bone is only expected, and with high resorption rate afterwards. Clinicians need to balance the benefit and risk for different procedures in each individual clinical situations. This is another chart showing the relative amount of bone cells, growth factors in each type of bone you have taken regardless of the site. This is more for reference since the majority of situations, the shape of the graft needed to rule the type of the bone graft you have to take, such as if you need augmentation of the thickness, you need a block. However, if you want to fill up an inlay defect, you may have to choose a particulate or cancellous type of graft. Autogenous bone harvest is still nowadays a gold standard for bone augmentation. For this reason listed here, there are numerous research to prove that biomaterials are very good indeed in many clinical situations nowadays. It could be beneficial since there are less morbidity and potential complication with the harvest site. And personally, I still trust and depend on autogenous bone graft for large bony defect and the bone augmentation at aesthetic zone, since some of the benefit could never be replaced by others. But don't forget, you could also do a mixture of autogenous bone and biomaterials to acquire the benefit of both. With current bone augmentation techniques, the scope and possibilities of dental implant therapy are dramatically expanded nowadays. Thank you very much for your attention.